When we look at the evidence needs for patients in CAR-T, I think part of the issues that we run into is CAR-T is still a relatively new kind of therapy. And yet when we're trying to measure the effectiveness not only of the disease but the impact on a patient's quality of life, we're using tools that were created for chemotherapies. And so when the therapies don't quite match, it can be really difficult to ensure that we're capturing the whole patient experience. And so that requires then that we go in, like Lymphoma Coalition does, and we do some extra requests of patients through both a survey and through some qualitative interviewing to really try and determine what's been missing in the research to date. So we can make sure that their clinic practice is better, but also make sure that we make some improvements to the products overall. And we can't do that unless we have a really good handle on that patient experience. So when we did the session at the European CAR-T meeting, we were integrating not only patient expectations, but some projects that are attempting to do that outside of what we're doing at Lymphoma Coalition. So there's been some work with a project through EORTC to create some new validated tools that we can use to measure quality of life and the impact of the treatment, both for CAR-T and for other T-cell based therapies like bispecifics. And as well, some recent work that T2Evolve has done to really, again, capture the patient experience. What I will say about T2Evolve and that project is they know that we do some surveying and do some patient interviews as well. And it really was a case where they came to us and we had discussions ahead of time to make sure our projects were coordinated yet focused in different ways. So we were capturing a more whole picture of that patient journey, which was really good. And the EORTC project, of course, we're working with them as well right now on creating that new validated tool. So there's good things coming, but still some gaps to fill at this point in time.